As we age with MS, we can face additional mobility problems and disease progression, but there are things that we can do to help. Today, I am thrilled to be welcoming back Dr. Gretchen Hawley from The Missing Link. Dr. Gretchen is a physical therapist and MS certified specialist who teaches science backed exercises that simultaneously rebuild and rewire neurological pathways while increasing muscle strength. Hi, Dr. Gretchen.
Hello, thank you so much for having me.
I'm so thrilled that you're back again. It's been a while, so welcome back.
Thank you.
So,
It feels like it's been way too long. I'm glad we were back together and chatting again.
yes, and does go so fast. And a lot of us are aging with MS. So, we find ourselves dealing with mobility issues along with our MS and age related issues. Can you talk about the differences in those mobility issues?
Yeah, that's a good question because there is a lot of overlap and there's a lot of some of the symptoms as we age are also going to happen even with MS. Like just because you have MS doesn't mean that you're not going to get aging and vice versa. So, with aging related changes, it's often generalized things. So, generalized worsening of balance. Maybe you're noticing that you're feeling a little bit unsteady when walking, or you might be tripping more just simply because you have some weakness in your legs and you're not lifting your legs enough. Walking might be more challenging just due to general lack of endurance or stamina. Whereas with MS, it might be those same things, but due to specific areas of weakness or specific areas that MS is targeting. For example, with MS, foot drop can be a super common symptom due to weakness in certain muscles and tightness in other muscles. So, when those muscles are weak or tight, you might be scuffing your feet due to MS targeting those areas, but also not lifting your leg enough due to age related weakness. Or another example might be another area that's super common for weakness is the outer hips. So if your outer hips get weak, one or both, your knees might cave inward. It can be called knee kissing, whether it's both knees or one knee. So you might be seeing that symptom because MS is attacking that area, but it also can happen due to generalized weakness. So there's definitely a lot of overlap.
Yeah, I am noticing I am postmenopausal now that I don't have the muscle mass that I used to, and I have to work a little harder to keep in shape. So, speaking of menopause, I've read that 30% of women with MS are menopausal or perimenopausal, and we tend to have slower progression with our MS than men until we hit menopause, and then we catch up a bit. Our MS tends to progress a little bit faster. Is there anything that we can do about it? Are there exercises that can help?
Yeah, so there are things that can help, and it's such a it's refreshing to hearing that you're bringing up this topic because there need to be more people talking about this. So often, I don't know if you've experienced this, but so often, my clients that I work with went to one of their doctors to say, "Hey, I'm experiencing worsened symptoms. Could be menopause, could it be MS?" And they're like, "Oh, go to this doctor." And then that doctor says, "Oh, well, go to your gynecologist." And they're just bouncing and no one actually wants to like give an answer or actually talk about strategies. But there are things that you can do when it comes to exercise. Any movement is going to be really, really helpful. What we know from research is that when we hit menopause, one of the most common symptoms that can occur due to hormonal changes, as well as due to worsened symptoms from heat intolerance or those hormonal changes, is mood and cognition. And we also know from research that exercise has a profound benefit on our cognition. Certain research says that even after just 3 months of consistent exercise, you can actually see positive changes in the brain from that exercise. So when it comes to exercise specifically during menopause, I haven't seen research on specific exercises that are best. It's more about doing what you can. So if that is going to a gym, and exercising there, great. If it's exercising in your home, I do so many of my exercises just in a chair back in this room. That's also great. So just doing what you can. And then another thing to keep in mind as we are approaching menopause or going through menopause are lifestyle factors to consider, making sure that you're getting good sleep. And that might mean changing some of your lifestyle habits, maybe cooling down your room, or maybe making sure that you're not on screens before bed, having good sleep hygiene. Hormone replacement therapy. Research shows that hormone replacement therapy does not worsen MS progression. Some people are fearful based on past research that has come out, but overall, what I have seen recently is that the majority of people, the benefits very much so outweigh the risks. So that might be appropriate. And again, you can talk to your doctors about that as well. But yeah, so thinking big picture, even just having some cool water. If you're going through menopause, heat intolerance, heat sensitivity can be real, and just keeping your core temperature neutral can make huge benefits and improvements in some of your symptoms.
Yeah, you're so right. I was actually just reading some recent research on estrogen, and maybe not estrogen and progesterone together, but estrogen on its own, topically in a cream or a patch, seems to help people with MS. It's still preliminary research, but it's exciting nonetheless. So definitely, I'm going to be talking to my doctors about that. And you're so right. Exercising consistently. I walk my dog or I walk with my neighbor every day. That is, I can be outside every day. And if I can't be outside, I'm on my treadmill, and I try to go to the gym consistently, and making sure that I'm hydrated and staying cool and getting good sleep. All great tips to help
Yes.
with menopause.
And it sounds so basic. It sounds like we've heard these same tips for years, and that might be true. But if you do them consistently, they really can make a big impact.
For sure. So, what are some of the top concerns from a physical therapist perspective on aging with MS?
I would say, and I can't speak for all physical therapists, but my top concern is falls. And so that could be due to poor balance or worsened balance. It could be due to weakness. And so you're tripping more, whatever the reason, falls is my biggest concern because as we age, and going through menopause, postmenopause, with those hormonal changes, our bone density drops and we're more likely to get osteopenia or osteoporosis. And when that happens and we have a fall, it's much easier to break bones and just get injured. And from what I've seen, I've been an MS specialist for 10 or 11 years now, and anytime I have a patient who has to undergo surgery for a fall, like a hip replacement or knee surgery or whatever it might be, it just takes longer to recover than if they didn't have MS. So, in an ideal world, we'd keep you safe and healthy, out of the hospital, out of surgeries, so that you can, keep maintaining where you're at and not have to risk falling back a few steps. Now, if that were to happen to you, it is still possible to recover and get stronger and continue, get back to walking and whatnot, but it might just take a little bit longer. So I like to try to avoid that situation if possible.
It's really important for us to be aware of our surroundings and our balance and our strength. I work with a physical therapist as well. And right now we're working on, I'm having a little bit of left side symptom flare. I think it's from the heat, but we're doing specific exercises to make sure that we're keeping that left side just as strong and keeping my balance between my left and right leg. I tend to be leaning more on my left leg because I can't feel it as much as my right leg. So, keeping my weight shifted evenly between both feet is important. Are there some functional exercises that may help us if we start to experience mobility issues with aging?
Absolutely. And just to touch on what you just said as well, I really think the first step to all of this is just becoming aware of where your body currently is. So even just the fact that you notice, okay, my left side is getting weaker. Okay, I'm putting more weight on this side of my body. that's amazing that you're aware of that. And so now we can come up with strategies of how to improve that. But one of the easiest ways that I like to think about best exercises for this period of life is to do the things that either are currently challenging or might become challenging. And these are often things that we do on a daily basis, like standing up from a chair or bending down to pick something up on the off of the floor. So, rolling to get out of bed. Those are such great exercises. So, if you don't mind, I'll step back to demonstrate what those might look like.
Excellent. It's always good to have demonstrations and how to.
So one of my favorite functional exercises that is great for this period of life is a lunge. And the reason for this is because it's great for strengthening lots of different muscle body parts, but it's really functional because separating your legs nice and wide and having a wide stance this way and just practicing going down even just a little bit can eventually allow you to bend down further so you can pick that thing up from the ground. Or, God forbid, you fall and you need to be able to stand up from the ground. One way to do that is this type of lunge. So, the more you do that now, the stronger you can get with those types of movements down the road. So, a lunge, and it's a wide lunge, it's not narrow, nice and wide on both sides, of course, is one of my favorite functional exercises for this phase of life. I also really like a squat and then separately a standing up and sitting down. So a squat you can do with a chair behind you, but with a squat, you're mostly focusing on hinging your hips backward and just bending a little bit and coming back up. And you're just using the same format. Now, one thing with a squat to keep in mind is only go as far as you can, but this might bother your knees, especially as we get into our 50s, 60s, 70s plus. Repetitive movements can make arthritis worse. It can just not feel great. So instead of lots of repetitions, you can just add a hold. So instead of just holding for 1 second, maybe stay here for 5 seconds or 10 seconds, however long you can, and then come up. And you would do fewer repetitions. But that differs from the sit to stand. Also, never use a swivel chair, it's just what I've got here. So for a sit to stand, you're fully sitting down and then you have to fully stand up. It requires more effort from more muscle groups, but you want to make sure your feet are nice and wide, bend your knees. And then the trick here is get your shoulders as far forward as you can, then stand up. And then when you sit down, again, shoulders come as far forward as possible, then sit down. Where most people go wrong and you will plop is if your shoulders come back. So keep those shoulders forward. It sounds easy, but it's hard to do. So those are three of my favorite functional exercises. There's a bunch of other exercises that would be helpful too, but I like those ones because they are directly related to our daily movements that we need strength and balance in.
I love that. Thank you so much for those demonstrations. And those little tips and those little changes to how we do things, like leaning forward before we stand up, or doing the squat and holding it instead of doing multiple squats. Those are really helpful. Like I said, with the heat, my left leg has been more affected this summer, and I've noticed I'm scuffing my left foot more. So I was looking for help with that. And I found your blog on healthy aging with MS. And there's lots of great tips in that blog. And I'll put it in the description below so everybody can check it out. But one of the exercises that I'm doing now, which is a functional exercise, is tapping my toes. It's
Yes.
something so simple, but just tapping my toes moves the muscles that will help with that dorsiflexion and lift up that foot. And because it's my left foot, I can do it while I'm driving and focus on the left foot. So I'm
Yes.
listening to the radio and I'm tapping my left foot. So
Yeah,
I love
that ankle dorsiflexion exercises is one of my staples for every person that I work with because foot drop or drop foot, foot slap, whatever we want to call it, is so common that even if it's not affecting you right now, it's still a good idea to strengthen those muscles. And yeah, it's so simple. So many people that I teach it to will, I don't know if I should advertise that they're doing it while they're driving, but if it's their left foot, it's okay. But also just as they're watching a YouTube video, they'll do that exercise, or as they're eating a meal. And for those that don't know what it is, you sit up nice and tall. Your feet can be further away from you. Here's a tip for it. The closer your feet are backwards, the more closer you are to a 90-degree knee angle, the harder it's going to be. So you can move your feet a little bit further away and then lift one or both feet up. Heel stays down, everything else lifts, and then lower. And then the same thing on the other side. Also, a little tip for you with this one is try your best to make sure your foot is staying flat, that it's not curling or rolling one direction or the other as you're lifting or as you're lowering. That way, you're making sure that you're strengthening the inside and outside of your ankle and the front of your ankle equally versus more of one side than the other.
Excellent. Thank you so much for showing us that and those tips. Anything else that we can be aware of as we're aging with our MS, particularly the ladies, because our MS is going to be speeding up possibly as we age?
One thing that I think is going to be really important to keep in mind is tracking your symptoms and also tracking possible triggers. Because as we age, it is true that MS might start to progress, and the trigger and cause is MS. But it's also very likely, especially during perimenopause, actual menopause, and postmenopause, that worsened symptoms could be triggered from something else. It might be triggered from hormonal changes, in which case maybe you could try a cream like we were talking about earlier. It could be triggered from heat sensitivity. Even if it's winter, if your core temperature rises by at least a quarter of a degree, any symptom can worsen. Or a cold intolerance. Even if you've never experienced that before, your core temperature dropping by a quarter of a degree can make any symptoms worse. So thinking about it in that way can make it easier and quicker to find possible solutions. And I would also just recommend, too, being open to the idea that even if something didn't affect you before, it might affect you now. And that's fine, but because knowing that can help you come up with a strategy. So often I work with women who are in their 60s and they've never experienced heat intolerance until now. And it wasn't until I asked them, do you think it could be from the heat? And their first response is always, no, no, I know that's really common for MS, but it's never been a problem for me. And then as we begin talking further, they're like, oh, I guess maybe that is what it could be. So keeping an open mind, tracking those symptoms and what possibly could be triggering it so that you can find that solution even faster.
Awesome. Thank you. What a great way to end this. Please tell everybody where they can find you and a little bit about your program, The Missing Link.
Yes, absolutely. So you can find me on YouTube, Dr. Gretchen Hawley, or Instagram as Dr. Gretchen, and my website is drgretchenhawley.com. And Missing Link is my online exercise and health education program for people with MS. So, as a physical therapist, of course, there's lots of research based exercises and calendars that tell you exactly which exercises to do each day to walk better, get stronger, get better balance, reduce spasticity, you name it. But then we also bring in MS experts in other areas like MS neurologists, pelvic floor physical therapists, registered dietitians. And so it's a really well-rounded approach of that education, and you get your questions answered from myself as well as our experts. And then of course we've got our community aspect as well, which is just, it feels like such a virtual hug to get time in there every day and just see everyone's wins and struggles and products they find helpful. So we're one big happy family over at the Missing Link.
That community aspect is so important, so we don't feel alone, and we can share our wins and our struggles with others who are facing the same thing. And you also recently just did a course on a conference you went to.
Yes. So I am, extremely passionate about sharing research in the MS space because, first of all, there's a lot of hope right now in the research world. There's so much research happening in areas that have never been researched before that could lead to therapies for remyelination or improving mobility, reducing spasticity. And so I recently went to the annual MS conference, and with everything, all the knowledge I learned there, I decoded it, took out the most important parts and made it easy to understand, and then combined it with other research that I've done and found, and created this one course called MS Research Made Simple, where it's my overview of just sharing what you need to know about each of these 10 topics. And then, of course, we have a quick reference cheat sheet takeaway. And if you're someone who likes to look at those studies, I actually included the citations for each of the cited lectures and studies articles for each of those. So you can dive into the research yourself if you want to.
Awesome. It sounds great. Sounds like you would be a great buddy in high school for study notes.
Yeah.
Uh, I will put all the links to where you can find Dr. Gretchen, the missing link, and her new course from the conference in the description below. Thank you, Dr. Gretchen, for joining me today. Always such a pleasure.
Thank you so much for having me.
And thank you, everybody, for joining us. If you would like to see more on Dr. Gretchen and what we've talked about in the past, you can watch these videos here next. And make sure you like and subscribe. Have a great day. Until next time, be well.